non-steroidal anti-inflammatory drugs means what? These drugs does not have any steroid nucleus in their structure. So those drugs which are having steroid nucleus in the structure, they are known as the steroidal anti-inflammatory drugs. So both these drugs, they have application in the pain and inflammation. So analgesics and anti-inflammatory drugs. So these are two separate categories. First one is the central analgesics. In that case, you have opioid analgesics. Those drugs which will interact with the opioid receptor and they will decrease your pain, they will reduce your pain. They are nothing but the opioid analgesic or central analgesic. And second one is peripheral analgesics. So those drugs which will act on periphery, not by central mechanism, they are known as a peripheral analgesics. In peripheral analgesics also there are two subtypes. Okay, first one is a steroidal analgesic anti-inflammatory drugs. So, and second one is a non-steroidal anti-inflammatory drugs. Okay, so that is the basic difference. So steroidal anti-inflammatory drugs will act on a different pathway, and non-steroidal drug will act on a different pathway. So basically these drug will prevent, these drug will inhibit the production of the endogenous chemicals responsible for the pain sensation. For example, there are numerous endogenous chemicals which are released whenever there is an injury, or whenever there is a there is a whenever there is injury, or whenever there is a tissue necrosis. Okay, so in that case there is generation of different endogenous chemicals. For example, there is generation of your prostaglandins, there is generation of your leukotrienes, there is a generation of your prostacyclins, etc. So these are the pain mediators. They will increase the sensitivity of peripheral nerves to the pain. Okay, so in this way they will act as a pain mediators. For example, आपको इतना याद रखना है कि जैसे आपका जो पेरीफेरल में analgesics, antipyretics. The basically term analgesic means those drug which will relieve your pain, or those drug which will decrease your pain sensation. They are known as analgesic. And antipyretics means what? Antipyretics means what? Pyresis means increase in the body temperature. The pyresis means increase in the body temperature. So antipyretics means these are the drug which will decrease your raised body temperature, or these drug that will decrease your increased body temperature. Those are known as antipyretics. And analgesics means those will decrease your pain. Basically, I have told you there are two kind of analgesics: central analgesics and peripheral analgesics. Central analgesics means what? They are known as opioid analgesic. We have discussed those drugs in the last lecture. Last lecture में अपन ने देखा था कि opioid analgesic क्या होता है, how they will act, what are the drugs, different drugs, their classification and all that. So opioid drug will interact with the opioid receptor, or opioid drug will combine with the opioid receptor and they will decrease your pain. They will nullify your pain. So those are known as opioid analgesics. Peripheral means they will not interact with the opioid analgesics. They will not interact with the opioid receptor. They don't have any concern with the opioid receptor. So they act as analgesic by different manner. Okay, so those are nothing but the peripheral analgesics. So in that also there are two types. Okay, so first is a steroidal drug. So those containing steroid nucleus, for example, dexamethasone, then betamethasone, then prednisolone. So all these are the steroidal anti-inflammatory drugs. Steroidal anti-inflammatory drugs. So they will act by inhibiting the phospholipase enzyme. Okay, so that I will show you in the upcoming slide the mechanism of both. Okay, and second one is a non-steroidal anti-inflammatory. So NSAID, what we call it is a NSAID. So they will relieve your pain without interacting with opioid receptor. Okay, so these are the non-steroidal anti-inflammatory. Again, these drugs are also able to reduce your temperature. Whatever temperature is increased, whatever temperature of your body is increased because of numerous reasons. For example, because of infection, or because of infection, or because of pyrogens, etc., etc. So that will be reduced by antipyretic drugs. And these drugs, NSAIDs, these drugs will have anti-inflammatory property. Okay, therefore they are known as non-steroidal anti-inflammatory drugs. They will reduce your pain without interacting with the opioid receptor. They will reduce your body temperature up to a normal, not less than normal. Okay, so whatever elevated temperature is there, and they also has a anti-inflammatory properties. That's why they are known as NSAIDs, non-steroidal anti-inflammatory drugs. Okay, again, in addition to these three properties, in addition to these three properties, most of the drugs belonging to NSAIDs will have anti-platelet activity. Anti-platelet means they will prevent the platelet aggregation, and that's why they have another application in the in the hematology as an anticoagulant. Is that clear? These drugs, they do not causes sedation, sleep, or addiction. So NSAIDs, whatever analgesic antipyretics are there, non-steroidal anti-inflammatory drugs, so they will not cause any kind of sedation, sleep, or addiction. Okay, so it is a contradictory to opioid analgesics. So opioid analgesics, they are central analgesics. They will reduce your pain by interacting with the opioid receptor. They have numerous adverse effects, like they will cause sedation, they will cause euphoria, they will induce the sleep, and they are liable to cause a habituation. They are liable to cause a dependence. But these non-steroidal anti-inflammatory drugs, they will not cause you any kind of sedation, they will not induce sleep, and they will not cause addiction, or they will not have addiction liability. So there is the basic difference between central analgesics and these non-steroidal anti-inflammatory drugs, right? So how there is a temperature regulated in the body? Okay, so how temperature is regulated in the body? So there is one center known as a temperature regulating center present in the medulla oblongata, that is hypothalamus. Temperature regulatory center is there in the hypothalamus. Okay, so that hypothalamus center will regulate your body temperature. So what is your normal body temperature? Anyone please? What is normal body temperature? So body core temperature is measured more accurately by rectal temperature. Okay, so most of the time your body temperature is measured by your underarm temperature or mouth temperature, but that is not most accurate. So most accurate body temperature can be measured by rectal temperature. Okay, so they will insert a thermometer in your rectum, and that will give you a most accurate temperature of your body, and it will be around 36.1 to 37.8. That will be your normal body temperature. Actually it is average. It can vary with individual and depending upon the condition like environment and all that. Okay, but it is an average. Okay, please mute your mic if somebody's mic is on, please. Then what is meant by hyperpyrexia? Okay, what is meant by hyperpyrexia? So increased in the body temperature more than normal, that is known as a pyrexia. And what is hyperpyrexia? So if your body temperature or if core temperature is more than 41 degrees Celsius, then this is known as a hyperpyrexia. So hyperpyrexia results in the hyperpyrexia result in the complications. It may be fatal to the person, because you see, if increased body temperature more than 41 degrees Celsius, it result in the convulsions, it result in the epilepsy, it result in the coma, and you may die. So hyperpyrexia is dangerous. So okay, so to counteract this pyrexia, to counteract this increased body temperature, our body has a own mechanism. Okay, so body temperature is controlled by two mechanisms. Okay, what are these two? First one is a peripheral mechanism, that is a cutaneous vasodilation. जो आपकी peripheral blood vessel है वो dilation हो जाएगा उसका. So there will be vasodilation, cutaneous vasodilation, and increased sweat gland activity. Okay, so your sweat gland activity will be increased, and sweat gland will secrete your sweat. जो भी आपका पसीना आ जाएगा, और जैसे ही पसीना evaporate होता है तो you will get a cooling effect. So it is one of the counter measure for increased body temperature. So cutaneous vasodilation will be there. Increase in sweat gland activity will be there through a sympathetic cholinergic fibers. Okay. Then again, increase in body temperature is brought by about hypothalamus, which reduces the heat loss by peripheral vasoconstriction and increase in the heat production by inducing shivering. Okay. So how there is an increase in body temperature? क्यों होता है increase body temperature? क्या होता है कि जब भी आपका कोई एक्सटर्नल इन्फेक्शन हो जाता है, या फिर कोई आपको पायरोजन का या लिपोपॉलीसेकेराइड या फिर कोई इन्फेक्शन हो जाता है, या पायरोजन आता है आपके बॉडी में, तो इमीडिएटली हाइपोथैलेमस में जो आपका टेम्परेचर रेगुलेटिंग सेंटर है, दैट विल बी सेट टू ए हायर लेवल, that will be set in a higher level, so that your body temperature will be increased. How it will be increased? It will be increased by vasoconstriction. आपके पेरिफेरल ब्लड वेसल कंस्ट्रिक्ट हो जाएंगे और हीट लॉस कम हो जाएगा. अगर heat loss नहीं होगा तो means your body temperature will be increased, right? That's how your hypothalamus will increase the body temperature in response of your infection and other conditions. Okay, and again heat production, it will also increase the heat production by inducing the shivering. Shivering मतलब क्या होता है आपको मालूम होगा. शिवरिंग मतलब आपके आंग पे जब काटा आता है, मतलब आप जब ठंडी बजती है, मीन मतलब इसके एपिसोड्स होते हैं. ठंडी बजना आपका थर थर कांपना, थर कांपना, तो उसको बोलते हैं शिवरिंग. तो शिवरिंग एंड cutaneous vasoconstriction will increase the body temperature, and that will be counteracted by cutaneous vasodilation. It is a one mechanism. Another mechanism is there. What are the pyrogens? Pyrogens are nothing but the bacterial products that are the bacterial lipopolysaccharide that will activate the mononuclear what are the pyrogens? Pyrogens means these are the agent which will increase the pyresis, which will increase the body temperature. So pyrogens are nothing but the bacterial lipopolysaccharide that will activate the mononuclear phagocytes. Okay, so whatever phagocytic cells are there in your body, that will be activated, and these phagocytic cells will release chemicals known as the interleukin first and tumor necrosis factor, that is a TNF. Interleukin first and TNF will be released in response to pyrogen. अगर आपके बॉडी में पायरोजन का एंट्री होता है तो आपके बॉडी का जो डिफेंस मैकेनिज्म होता है, जो फैगोसाइटिक सेल्स होता है, वो क्या करेंगे, दे विल रिलीज केमिकल्स नोन एज इंटरलूकिन एंड ट्यूमर नेक्रोसिस फैक्टर, एंड दिस TNF will act on a vascular endothelium and stimulate the local production of prostaglandins, particularly prostaglandin E1 and E2. Now these prostaglandins are responsible for the fever, anorexia. Okay, also they will increase the sensitivity of nerve ending to the pain. Okay, so that's how you will get a pain and fever. Okay, now what is the inflammation? So these chemicals again, these prostaglandins, leukotrienes, okay, these chemicals again, they will produce increased impermeability to the blood vessels. कि blood vessel का permeability increase करेंगे तो अंदर जो भी फ्लूइड है, permeability increase होगा तो जो vascular fluid है वो बाहर आ जाएगा, interstitial space में आ जाएगा. उसमें क्या होगा, जब इडिमा हो जाएगा आपको, ठीक है, आपको सूजन हो जाएगी, तो इडिमा होगा, उसमें पेन होगा, उसमें और केमिकल जमा होंगे. ये जो है ना प्रोस्टाग्लैंडिन्स, प्रोस्टाग्लैंडिन्स, ल्यूकोट्राइन्स, थ्रोम्बोक्सिन, ये जमा हो गए वहां पे. सो पायरोजेंस विल increase your body temperature. In the response of your pyrogens, your body's defense system, that is phagocytic cells, will release chemicals, endothelial chemicals known as interleukin 1 and tumor necrosis factor. Okay, these tumor necrosis factor will also stimulate the vascular endothelium. Vascular endothelium मतलब blood vessel का जो inner layer होता है उसको बोलते हैं vascular endothelium. So to synthesize prostaglandins, and these prostaglandins are nothing but they are the pain mediators. They are the root cause for inflammation. Okay, they will cause inflammation, pain, fever, anorexia, etc. So you know that how pain is there, how increase in body temperature is there. So if you know these things, you can easily counteract this. Okay, so inflammation is what? Inflammation is nothing but it is a reaction to the tissue after the injury. Suppose that you got an injury, so after injury you will get tissue necrosis, then swelling, then pus formation, inflammation. Okay, so that is nothing but the reaction. Inflammation is nothing but the reaction to the living tissue after injury. Okay, there are three aspects of the inflammation. First one is erythema. Erythema means there is a local vasodilation and release of vascular fluid into the cells. So erythema. Then edema means increased vascular permeability and increased intravascular fluid into outside. So there will be edema. Edema means sujan. So edema. Then formation of granulation tissue, and these all leads to pain. Okay, so that is the inflammation. What is the mechanism of anti-inflammatory drugs? What is the mechanism of non-steroidal anti-inflammatory drugs? How they will counteract the inflammation, pain, and pyrexia? see what happens during the inflammation, pain and fever. So whenever there is an injury to your any part of your body, so there is a release of arachidonic acid. There is a release of this arachidonic acid which is liberated from the phospholipid fraction of your membrane. Okay, so you know that your biological membrane is made up of phospholipids. Okay, so that whenever there is an injury, there is a release of arachidonic acid from the phospholipid fraction of your cell membrane. Okay, now this arachidonic acid is released from the cell membrane by the action of your phospholipase C. Okay, phospholipase C. There is one enzyme known as phospholipase C that will release arachidonic acid. Phospholipase, as the name indicates, lipase means it will break down the lipids. Phospholipase means phospholipid को break down करने वाला enzyme. So phospholipase C will came there. It will break down the phospholipids from the cell membrane and it will release the 20 carbon atom arachidonic acid. That is unsaturated. Okay, we have seen in the biochemistry arachidonic acid. That is unsaturated fatty acid. So it is a 20 carbon atom fatty acid that will be released. Now this arachidonic acid is converted step by step into the inflammatory mediators. Okay, so that is a prostaglandin, then the thromboxane A2, prostaglandin E1, then prostaglandin. Numerous prostaglandins are there. Okay, mostly prostaglandin E1 and prostaglandin. So this arachidonic acid is converted into cyclooxygenase by the enzyme. Arachidonic acid is converted into prostaglandin by the enzyme cyclooxygenase. There are three kind of cyclooxygenase or COX. It is in short it is known as a COX, COX, cyclooxygenase. So there are three enzymes, COX1, COX2 and COX3 is also there. These enzymes will convert your arachidonic acid into prostaglandins. Now these prostaglandins itself has a increase the sensitivity of pain of nerves. Okay, so prostaglandins will sensitize blood vessel to the effect of other inflammatory mediators, and also that will increase the permeability of vascular permeability of blood vessels. That will increase the erythema, then that will cause edema, pain, necrosis and all that. So the main chemical responsible for the pain, inflammation and edema is nothing but the prostaglandins. Okay, prostaglandins, and how it is formed by the cyclooxygenase pathway. Okay, so there are 2-3 pathways. So we are going to see in the upcoming slide. For our interest, it is a cyclooxygenase pathway. Okay, so there are 3 enzymes: COX1, COX2 and COX3. So that also we will be discussed in the upcoming slide. Don't worry. So these finally prostaglandins, these are the pain mediators. They will increase the permeability of blood vessel and they will cause necrosis, edema, vasodilation, pyrexia, etc. So now there are 3 COX. There are 3 kind of COX enzyme. That is cyclooxygenase 1, cyclooxygenase 2, cyclooxygenase 3. Now what is their role? So COX1 is it is present in the all type of cells. Okay, so it is a constitutive enzyme and present in the all type of cells. So it is a normal constituent of cell. Okay, so COX1 is a constitutively present in the cell and in all the type of cell. Okay, and it is this COX1 is involved in the tissue hemostasis, normal tissue hemostasis, and this COX1 has a housekeeping function. Okay, housekeeping function means when there is a do or die situation for the cells, in that situation COX1 will come into picture and it will show its function. जैसे आपको इंजरी होता है तो COX1 क्या करेगा, वो साइक्लोऑक्सीजनेस को जो arachidonic acid है उसको क्या करेगा, कन्वर्ट करेगा प्रोस्टाग्लैंडिन्स में, ताकि इन्फ्लेमेशन हो जाए और जहाँ पे जो टिश्यू को इंजरी हुई वो टिश्यू डिस्ट्रक्ट हो जाए. इन्फ्लेमेशन नेक्रोसिस होने के बाद वो टिश्यू मर जाता है. ठीक है, तो ये इसका हाउसकीपिंग का फंक्शन है COX1. Now what is COX2? COX2 is normally absent from the cell. Okay, normally it is not present in the all cells, but it is present in the kidney and brain. This COX2 is inducible. It can be induced by bacterial lipopolysaccharide, interleukin-2 and tumor necrosis factor, activated lymphocytes and other inflammatory cells. So it can be induced. It is not normal constituent of your cell, but it can be induced by various bacterial lipopolysaccharides, means pyrogen. and these two chemicals, endogenous chemicals known as interleukin 2 and tumor necrosis factor, which is generated above. Okay, जैसे वहाँ पे पहले generate होगा तो उससे COX2 induce होगा. Now COX3 is also there. This is actually present in the brain and it is involved in the regulation of your temperature. So COX3 is present in the brain. So whatever increased temperature is because of this COX3, and the paracetamol is acting as an antipyretic by inhibiting this COX3 in the brain. So you can see here, if injury to your any organ or any tissue, there will be rupture of your cell membrane. There will be rupture of your biological membrane. When there is a rupture of biological membrane, there is a one enzyme will come into picture known as a phospholipase A2. Okay, phospholipase A2 will come into picture and it will release arachidonic acid from the damaged cell or damaged tissue. So once arachidonic acid is released, now this arachidonic acid has a two fate. ओके, so ये arachidonic acid रिलीज होने के बाद वो कन्वर्ट हो जाएगा डिफरेंट डिफरेंट केमिकल्स में. सो उसके लिए दो पाथवे अलग अलग से. सो फर्स्ट arachidonic will be acid at the one hand, arachidonic acid will be converted into prostaglandins. Arachidonic acid will be converted into prostaglandin by the enzyme known as a COX. COX is nothing but the cyclooxygenase. Okay, by one hand it will be converted into prostaglandins, and on the other hand it will be converted into leukotrienes. So this arachidonic acid will be converted into prostaglandin by cyclooxygenase. Okay, and all the non-steroidal anti-inflammatory drugs, okay, they will inhibit this enzyme COX. Okay, so there are three enzymes, COX1, COX2 and COX3. So COX1 is mostly involved in the inflammation, COX3 is mostly involved in the pyresis. Okay, जो COX3 होता है वो ब्रेन में होता है. COX1 जो होता है, it is a normal constituent of cell and it is a housekeeping. It has a housekeeping function. Remember, ये क्वेश्चन एक बार आया था GPAT में. So which COX is a non-inducible and housekeeping function? So COX1. So COX2 is not present in the most of the cells, but it is inducible. It is present in the renal and brain, and it is inducible. Okay, it is inducible. So COX3 is present in the brain, and that is responsible for the temperature regulation. And these arachidonic acid will be converted into various prostaglandins like prostaglandin G2, H2, prostaglandin D, E2, alpha-2, this, and this will also again be converted into thromboxane A2. So these prostaglandins will be arachidonic acid will be converted to prostaglandin in the cell. This PGI2 will be there also in the cell, and this thromboxane A2 will be in the platelets. Okay, so arachidonic acid is converted into prostaglandin and thromboxane. So in the tissue cells it is converted into prostaglandin, and in the platelets it is converted into thromboxane A2. So prostaglandins, they are powerful pain mediators. They will increase the sensitivity of nerves to the pain. And this thromboxane A2 is a powerful platelet aggregation. It is responsible for the platelet aggregation in the platelet. So inhibition of this COX2, inhibition of this COX1, COX2, COX3 will result in the decreased synthesis of this prostaglandins and thromboxane A2. Okay, so अगर वहाँ पे prostaglandin बनेंगे ही नहीं तो आपको पेन होगा ही नहीं, है ना. So that's how prostaglandins will be synthesis of prostaglandins will be inhibited by non-steroidal anti-inflammatory drugs. And again इसमें भी बहुत सारे ड्रग्स है जो एंटी प्लेटलेट एक्शन दिखाते हैं. मतलब they will prevent the platelet aggregation. How? So they will prevent the formation of this thromboxane A2, and thromboxane A2 is a powerful platelet aggregation, is responsible for the platelet aggregation. So अगर ये प्रोड्यूस ही नहीं होगा तो platelet aggregation होगा ही नहीं. So that's how this NSAID will act as a analgesics as well as anti-platelet agent. Now this arachidonic acid on the other hand is converted into leukotrienes by pyolipoxygenase. Arachidonic acid is again converted into leukotrienes by pyolipoxygenase enzyme. So this enzyme is inhibited by xylitol. So leukotrienes will be there like leukotriene B4, leukotriene C, D, E. Okay, these leukotrienes will act on a different leukotriene receptors. Okay, and they will cause bronchoconstriction and inflammation in the bronchus. You will come to know these drugs are those drugs which will inhibit this pathway. They are acting as a analgesic and anti-platelet agent. Okay, अगर COX को इनहिबिट करने वाला कोई ड्रग है तो वो क्या करेगा, पेन रिलीव करेगा, इन्फ्लेमेशन रिलीव करेगा, आपका टेम्परेचर कम करेगा और प्लेटलेट एग्रीगेशन नहीं होने देगा, ठीक है। तो ये पाथवे, अगर कोई कोई ड्रग अगर लिपोऑक्सीजिनेज एंजाइम को इनहिबिट करेगा तो वो क्या करेगा, ही द ड्रग विल प्रिवेंट formation of leukotrienes and in the lastly it will prevent the bronchoconstriction. So the drug which will inhibit this side, okay, so they will act as a, they will be useful in the asthma, okay. So those drug which will inhibit these steps, those will be useful in the treatment of asthma. Those drug which will inhibit this side, those will be useful as an analgesic and antiplatelet drug, okay. Now स्टीरॉयडल ड्रग जो होते हैं, स्टीरॉयड ड्रग वो कहाँ पे एक्ट होते हैं, सो दे विल इनहिबिट दिस एंजाइम फॉस्फोलाइपेज A2. सो इन द वेरी फर्स्ट स्टेप स्टीरॉयडल ड्रग्स विल इनहिबिट द फॉस्फोलाइपेज A2 एंड दे विल प्रिवेंट द फॉर्मेशन ऑफ एराजिडोनिक एसिड. अगर एराजिडोनिक एसिड ही नहीं बना तो बाकी का कॉम्प्लिकेशन का आने का सवाल ही नहीं होता ना. तो दैट्स व्हाई स्टीरॉयडल ड्रग्स आर मोस्ट इफेक्टिव. Steroidal anti-inflammatory drugs are very powerful and most effective because they will prevent the formation of arachidonic acid and further complications. Okay, अगर वो नहीं दे सकते आप तो बन गया एराजिडोनिक एसिड. एराजिडोनिक एसिड से क्या बनता है, दो टाइप होता है, उसमें दो केमिकल्स बनते हैं, एक तो प्रोस्टाग्लैंडिन बनता है और एक तो ल्यूकोट्राइन बनता है. अगर प्रोस्टाग्लैंडिन जो बनता है वो प्रोस्टाग्लैंडिन क्या करेगा, प्रोस्टाग्लैंडिन आपको पेन करेगा, इंफ्लेमेशन करेगा, ठीक है, आपके बॉडी का टेम्परेचर इंक्रीज करेगा. उसको इनहिबिट कैसे कर सकते हो, NSAID से, नॉन स्टेरॉइडल एंटी इंफ्लेमेटरी ड्रग्स बाय COX-1, COX-2, COX-3 जो भी है, मोस्टली COX-1 होता है. COX-1 इज रिस्पॉन्सिबल फॉर द इंफ्लेमेशन एंड पेन. COX-3 इज रिस्पॉन्सिबल फॉर द पायरेसिस, इंक्रीज बॉडी टेम्परेचर. ओके, नाउ दिस अगर those drug which will inhibit this formation of leukotrienes they are useful in the asthma. ये अलग चैप्टर है, इसके ऊपर एक अलग चैप्टर होता है, ठीक है, बाद में देखेंगे उसको. अभी आपको इतना समझ में आएगा COX is responsible for the generation of pain mediators. Okay, now next one is now we will see the classification of your analgesic antipyretic drugs or NSAIDs. So these drugs are classified into three types. First one is a non-selective COX inhibitor, means they will inhibit the COX-1, COX-2, COX-3 all. So they are non-selective in action. So non-selective COX inhibitors. Okay. Second one is a preferential COX-2 inhibitor, means they will inhibit COX-2 more than COX-1. ऐसा नहीं कि सिर्फ COX-2 को ही inhibit करेंगे, COX-1 को भी करते हैं, लेकिन ज्यादा किसको करते हैं, COX-2 को. So they are known as a preferential COX-2 inhibitor. And third category is a selective COX-2 inhibitor. So there are three categories. Non-selective COX inhibitor, they will inhibit both COX-1 as well as COX-2. And preferential COX-2 inhibitor, they will inhibit COX-2 more than COX-1. And last one is selective COX-2 inhibitor. Okay, they will inhibit only COX-2. Now non-selective COX inhibitor, what are they? They are salicylic acid. For example, first class is salicylic acid. So example is acetyl salicylic acid or aspirin. Then methyl salicylate is there, sodium salicylate is there. There are a lot of drugs. Okay, again second class is a para-aminophenol derivative, that is a phenacetin and paracetamol. Then third class will be your pyrazolone derivative, that is a phenylbutazone, oxyphenbutazone. Okay, then next class will be your indole derivative. Indole means indomethacin and sulindac. Then heterocyclic aryl acetic acid derivative. So example is diclofenac, tolmetin, ketorolac. Then propanic acid derivative, for example ibuprofen, phenoprofen, naproxen, ketoprofen and pypropen, fluripropane, lot of drugs are there. Then phenamates, for example mefenamic acid, flufenamic acid. Oxycams, for example paroxicam, meloxicam. Okay, so these are the non-selective COX inhibitors. That means they will inhibit COX-1 as well as COX-2, or they are also known as a traditional non-steroidal anti-inflammatory drugs. Non-selective drugs are known as a traditional NSAIDs. Okay. Now next class is a preferential COX-2 inhibitor. Means they will inhibit preferentially COX-2. Okay. Means they will inhibit more COX-2. They will inhibit COX-2 more than COX-1. तो ऐसा नहीं कि सिर्फ COX-2 को ही इनहिबिट करेंगे, COX-1 को भी करेंगे, लेकिन उसका प्रेफरेंस किसको रहेगा, COX-2 को रहेगा. सो दोज आर नथिंग बट द निमोस्लाइड. ओके, निमोस्लाइड, नाबोमेटोन एंड मेलोक्सिकम. यह GPAT 20 में पूछा था इसके बारे में. देयर वाज अ क्वेश्चन इन GPAT 20. They have mentioned few drugs like meloxicam, nabometon and mostly oxycams was there. Meloxicam, nimoselide, nabometon. So these are, and there was option COX-1 inhibitor, COX-2 inhibitor, selective COX-2 inhibitor, and preferential COX-2 inhibitor. So answer was preferential COX-2 inhibitor. Okay. So then last class is the selective COX-2 inhibitors. So they are nothing but the coxibs. Okay. So celecoxib, iterocoxib, paracoxib, rafocoxib, etc. etc. All the coxibs are selective COX-2 inhibitor. इसके ऊपर भी एक बार GPAT में क्वेश्चन था. Identify selective COX-2 inhibitor. Okay. So all the coxibs, they are selective COX-2 inhibitor. Okay. This nimesulide, nepometone and meloxicam, they are preferential COX-2 inhibitor. इसमें कंफ्यूज नहीं होना चाहिए सिलेक्टिव एंड प्रेफरेंशियल में. ठीक है. So you should not confuse between selective COX-2 inhibitor and preferential COX-2 inhibitor. Okay. And these all drugs are a non-selective COX inhibitor. They will inhibit COX as well as COX-2. Is that clear? Are you getting or not? Now next one is a first class. Your salicylates, salicylic acid derivatives. Okay. So salicylic acid derivatives, their pharmacological actions, their uses, their adverse effect, and all that. Okay. So salicylic acid derivative. So salicylic acid derivative like salicylate, then methyl salicylate, sodium salicylate, and acetyl salicylic acid. ASA, acetyl salicylic acid, is also known as aspirin. Remember, acetyl salicylic acid is aspirin. Okay. So this salicylate, methyl salicylate, and sodium salicylate, they are not used nowadays. Only acetyl salicylic acid is used. Okay. Salicylic acid means what? There is one benzene ring. Okay. At there is a benzene ring. There is a acid group, and there is one hydroxyl group near to each other. So that is nothing but that means benzene ring with ortho position, with one ortho position is with acid group and another ortho position is with hydroxyl group. That is a salicylic acid. That's it. So all are the derivative of salicylic acid. That will be seen in the next lecture when we will see same chapter with medicinal chemistry point of view. Okay. Now what are the actions of salicylate on the body? So it has a local action. It has an action on CNS. It has action on GIT. Okay. So locally these salicylates will act as an irritant, keratolytic, antiseptic, and fungistatic action. Okay. So irritant means they will cause irritation to your skin if applied locally. So then keratolytic means they will remove keratin. They will break down the keratin. Okay. So how they are applicable? What are their application of? What are the keratolytic application of salicylates? So अगर आपको कोई आपके स्किन में आपके जो पैर का जो what are the actions of salicylic acid and their derivatives locally when applied on the skin? They will act as irritant, keratolytic, they will break down the keratin. अगर आपके पैर में आपके स्किन के ऊपर कोई मस्सा है या फिर स्किन के ऊपर कोई केराटिन का डिपॉजिट है तो उसको रिमूव करने के लिए लोकली दे आर यूज्ड. Okay. So these salicylates are used as a keratolytic locally. Then they will act as antiseptic and fungistatic in the locally. Okay. Then now what are their central actions? So CNS actions. So they will act as analgesics. Okay. They will act as analgesic. Okay. Codeine and aspirin, when they are combined together, they will give you synergistic effect. Okay. So aspirin is nothing but the salicylic acid, acetyl salicylic acid, and it will irreversibly inhibit the biosynthesis of prostaglandin by inactivation of COX. Right. So remember, aspirin is a irreversible inhibitor of COX. The only non-steroidal anti-inflammatory drug will bind to COX and inhibit it irreversibly. Remember, irreversible inhibitor of COX. So aspirin is a irreversible inhibitor of COX. Right. So rest of the drugs, जितने भी बाकी के ड्रग है वो सब रिवर्सिबल इनहिबिटर है. ओके. सो एस्पिरिन इज इरिवर्सिबल इनहिबिटर. एक बार उसने बाइंड कर लिया एंजाइम को तो वो छोड़ता नहीं. इरिवर्सिबल इनहिबिटर. ठीक है. इट इज इरिवर्सिबल इनहिबिटर ऑफ synthesis of by that is prostaglandin by COX. Okay. So irreversible inhibitor of COX. And other जो drugs है they are reversible. So that's how it will prevent the formation of prostaglandins and will act as analgesics. Because prostaglandins they will increase the sensitivity of nerves to the pain. Okay. Or they are pain mediators. This aspirin is mainly used for dull, itching, throbbing pain. मतलब medium intensity pain or pain with low intensity arising from muscle and joint. Dysmenorrhea. Okay. Dysmenorrhea means abnormal abnormal discharge from ladies, that is nothing but the dysmenorrhea. Then toothache, अगर आपका दांत दुख रहा है तो उसमें भी यूज करते हैं. Then antipyretic, how they will act as antipyretic? So in case of fever, thermostatic mechanism is set to a higher level in the hypothalamus. We have seen this. So if there is increase in body temperature, means hypothalamus thermostat of hypothalamus is set higher level. These drugs, this aspirin will bring down the body temperature by resetting the thermostat in the hypothalamus. So in case of fever, thermostatic mechanism is set higher level. Salicylate will act centrally and will reset the mechanism of thermoregulation to a normal. Okay, and that's how they will relieve your increased body temperature. Then salicylates and paracetamol, they will inhibit the prostaglandins in the brain also by acting on COX-2. Okay, COX-2. Respiration. What is the effect of aspirin on respiration? So it will stimulate your respiration by directly stimulating the respiratory center present in the medulla, that is medullary center. Okay, and indirectly it will also stimulate the respiration indirectly by increasing the oxygen consumption by skeletal muscle. So it will stimulate respiration. It will stimulate respiration by two ways: by either directly stimulating to the respiratory center, it will act directly stimulant to the respiratory center, and again it will increase the oxygen consumption by skeletal muscle. So it is acting respiratory stimulant by two ways. Again, then what is the effect of aspirin on acid base balance? Remember, aspirin will cause respiratory alkalosis, and it will cause metabolic acidosis. Okay, there are two opposite terms. Metabolic acidosis means it will increase the acid level in the body, and respiratory alkalosis means जो रेस्पिरेटरी का कार्बन डाइऑक्साइड कार्बन आयन जो है वो बढ़ेगा, रेस्पिरेटरी अल्कोलिसिस करेगा, मेटाबॉलिक एसिडोसिस करेगा. रिमेंबर, सो मेटाबॉलिक एसिडोसिस caused by aspirin can be counteracted by giving the carbonate ions. What is the action on gastrointestinal tract? So aspirin will cause dyspepsia, nausea, vomiting. It will irritate your stomach. It will cause irritation to your stomach. So peptic ulceration may be result. Then GIT bleeding can occur due to its chemical nature. So aspirin is a weak acid. Okay, so it will remain unionized form in the stomach and it will irritate the gastric mucosa. So that's why dyspepsia, nausea will be there, vomiting. Nausea means आपको उल्टी आने जैसा फील होगा. Okay, then vomiting, then gastric ulceration, then your GIT bleeding. Okay, so these will be the action on GIT. Again, this will inhibit the local synthesis of prostaglandin. So prostaglandin will have a protective role also. So the local prostaglandin inhibition will also contribute to the action of ulceration produced by aspirin. So this is how there are the actions of aspirin. Now next one is how anti-inflammatory and anti-rheumatic actions are there of aspirin. So aspirin will act as anti-inflammatory and anti-rheumatic because of three reasons. So inhibition of prostaglandin synthesis by peripheral tissues, then reduction of capillary permeability of blood vessels, then inhibition of neutrophil aggregation and their activation. So by combination of these three mechanisms, it acts as the anti-inflammatory and anti-rheumatic. Okay, then what is the action of aspirin on blood and platelets? So all of you know that aspirin is a blood thinner. Okay, so it will prevent the platelet aggregation. So aspirin inhibit the platelet aggregation because it will irreversibly inhibit the COX in the platelet. So COX ऐसा नहीं कि साइक्लोऑक्सीडेज एंजाइम ऐसा नहीं कि सिर्फ सेल्स में बाकी सेल्स में प्रेजेंट है, ये तो प्लेटलेट में भी होगा ना. So inhibition of COX in the platelet will cause prevention of platelet aggregation. Okay, so aspirin inhibit the platelet aggregation by irreversibly binding with the COX present in the platelets, and it will cause acetylation of cyclooxygenase enzyme. Okay, so daily lower dose of aspirin, that is a 75 to 150 milligram daily dose of aspirin will completely suppress the synthesis of prostaglandin in the platelet for 7 to 10 days. So that's why this aspirin in the dose of 75 to 150 milligram, it is used for the prophylaxis of thrombosis, prophylaxis of myocardial infection. कि अगर जो किसी को मायोकार्डियल इन्फेक्शन का हिस्ट्री वगैरह कुछ है तो उसको एस्पिरिन दिया जाता है ये डोज में 75-150 ताकि उसको उसमें कोई थ्रम्बस ना बने, उसमें कोई क्लॉट ना बने और उसको मायोकार्डियल इन्फेक्शन ना हो, इसलिए so it is used for the prophylaxis of myocardial infection in dose of 70 to 150 milligram. This action is only aspirin has this action, not other salicylates like sodium salicylate or methyl salicylate. They are not having the antiplatelet action. Why? Only acetylated salicylates जो acetyl derivative है salicylate का वही उसको ही action है. So that is the acetyl salicylic acid. Okay. Now next one is what is the action of aspirin on liver and kidney. So in the liver it will increase the secretion of bile. Aspirin will increase the secretion of bile. That is a cholerectic action. Okay. So bile is nothing but the cholic acid. So it will increase the secretion of bile and that is a cholerectic action. Then uricosuric effect. In small doses, salicylates will interfere with the urate secretion, uric acid secretion in the distal tubule, and it will increase the plasma uric acid level. That is a uricosuric effect. But in large doses, for example 5 gram per day, inhibit the reabsorption of urate and it will increase the secretion of uric acid. So result in the uricosuric. Uricosuric effect means what? Increase in the excretion of uric acid. That is a uricosuric drug. So those drugs which will increase the secretion of uric acid in the urine, they are known as the uricosuric drugs. Okay. So aspirin only act as a uricosuric in the large doses, 5 gram per day, and it is not recommended. It is not used therapeutically in such dose. What is the absorption, distribution, metabolism, and elimination of aspirin? So salicylates are absorbed from stomach as they are weak acids. They will remain unionized in the stomach and they will better absorb from the stomach. So around 80% of salicylates they are absorbed from the stomach, upper area of duodenum and stomach, and 50% of most of the salicylates will bind to a plasma protein known as albumin. So 80% salicylates will bind to the albumin and 50% of aspirin will bind to albumin. So they will show a dose dependent kinetics like phenytoin. Okay, in the smaller dose their elimination kinetics will be first order. In the higher dose their elimination kinetics will be zero order. There is one derivative of this salicylate known as a diflunisal. So there is one derivative of salicylate known as a diflunisal. So it is a non-acetylated difluorinated derivative which has a higher analgesic and anti-inflammatory activity, but it is a non-acetylated derivative. So as it is a non-acetylated derivative, it will not have any anti-platelet action. Remember, जो acetylated derivative होता है salicylic acid का उसको ही anti-platelet action है, बाकी को नहीं. So it will be this how the salicylate will act as an analgesic, antipyretic, and anti-inflammatory. Now, what are the adverse effects of salicylates? So, what are the adverse effects of salicylates? So, first will be intolerance. So, आपका body salicylates को intolerance दिखाएगा, आपका body उसको tolerate नहीं करेगा, because every drug is a foreign chemical to our body. So, body will not accept it. So, it will result in the reactions such as a skin rash, स्किन के ऊपर रैश होगा, यूट्रिक एरिया, प्रोराइटिस, देन एंजियोन्यूरोटिक एडेमा, ओके, ब्रोंकोस्पाज्म, एनाफिलैक्सिस लाइक शॉक एंड थ्रोम्बोसाइटोपेनिया, porphyria. Thrombocytopenia means abnormal increase in the thrombocyte. Thrombocytes mean blood cells जो होते हैं thrombocytes. So abnormal increase in the thrombocytes, that is thrombocytopenia. So these will be the intolerance reaction, anaphylactic reactions in the patient with glucose 6 phosphate dehydrogenase deficiency. ये जो ग्लूकोज 6 फॉस्फेट डीहाइड्रोजनेज एंजाइम होता है जो जेनेटिकली जिसमें ये नहीं है तो उनमें क्या होगा, एनाफिलैक्टिक रिएक्शंस होगा. सो दिस salicylates will show anaphylactic reaction in the patients defective in the glucose 6 phosphate dehydrogenase. Okay, on the GIT it will cause dyspepsia, nausea, vomiting. ये तो common है, heartburn, ulceration. Actually it is a common to all non-steroidal anti-inflammatory drugs. So dyspepsia, nausea, vomiting, heartburn, ulceration. It is common side effect of all drugs, NSAIDs. Okay. Then chronic administration of aspirin can result into gastric bleeding. It acts as a irritant to mucosa, as well as it will prevent the synthesis of prostaglandin locally, which is a protective in function. So that's why. Now, main important adverse effect of your aspirin. So what is the adverse effect on the hematopoietic system? जो blood होता है, blood के ऊपर क्या adverse effect है? So it can decrease the prothrombin level by interacting with the vitamin K in the liver, by interfering with the synthesis of vitamin K in the liver. So it will decrease prothrombin level. And last but most important adverse effect of aspirin. So there was a question in GPAT20 also. So Ray's syndrome. So Ray's syndrome is an adverse effect of aspirin or salicylates. Okay. Ray's syndrome क्या होता है ये Ray's syndrome? So suppose that if a child below age of 12 years, कि छोटा बच्चा है, 12 साल का बच्चा है, 12 साल के नीचे है उसका एज, और उसको कुछ इन्फेक्शन हुआ है, फॉर एग्जांपल इन्फ्लुएंजा का इन्फेक्शन हुआ है, या फिर वेरिसेला जोस्टर जो अपना होता है ना, माता आई है, माता जो जिसको बोलते हैं चिकन पॉक्स का इन्फेक्शन हो गया, या फिर इन्फ्लुएंजा का इन्फेक्शन हो गया, और उस टाइम पे क्या होता है, फिर उसको फीवर वगैरह आता है, तो उस टाइम पे ये एस्पिरिन उसको देना नहीं है टू रिलीव द फीवर. अगर बाय चांस आपने दिया, सो इफ यू गिव एस्पिरिन टू ए child less than 20 years and having infection of influenza or varicella zoster, so it will result in a serious complication. It will result in the fatal reactions. Okay, and that reactions are nothing but the Ray's syndrome. That is nothing but the Ray's syndrome. So aspirin is contraindicated in the infants and children having age less than 12 years. Okay, so there will be liver dysfunction due to hepatic microsomal injury, and there will be metabolic encephalopathy. So Ray's syndrome क्या होता है? Ray's syndrome ये होता है कि अगर किसी को, छोटे बच्चे को, 12 साल के नीचे जो बच्चा है, उसको अगर कोई इन्फेक्शन हो गया, जैसे आपका इन्फ्लुएंजा वायरस है उसका इन्फेक्शन है, या फिर वेरिसेला जोस्टस जैसे चिकन पॉक्स का इन्फेक्शन है, तो उस टाइम पे जो फीवर आता है वो रिलीव करने के लिए आपको ये सैलिसिलेट्स का यूज नहीं करना है. अगर उसमें यूज किया तो फेटल कॉम्प्लिकेशंस होते हैं, उसके जान पे आ सकता है वो सब, क्योंकि aspirin will show a serious adverse reaction in such kind of patients. So that is nothing but the Ray's syndrome, and this was question in GPAT20. Now next one is what are the adverse reactions of salicylate? Next one is what are the other adverse reactions? So in pregnant woman and infants. So if salicylates are used in the pregnant woman and infants, it may delay the onset of labor and may cause greater blood loss at the delivery. अगर प्रेग्नेंट वुमन में यूज करेंगे तो आपका जो लेबर है वो डिले हो जाएगा, मतलब बच्चे का जन्म जो होता है वो डिले हो जाएगा. उसके बाद में देयर आर चांसेस ऑफ गेटिंग ब्लड लॉस मोर देन नॉर्मल बिकॉज एस्पिरिन इज अ एंटीप्लेटलेट. ओके, देन अगेन aspirin and another drug, indomethacin. Aspirin and indomethacin, they can cause premature closure of ductus arteriosus and result in the serious pulmonary hypertension in the newborn. कि न्यूबॉर्न जो बच्चा नया नया जन्म लेता है तो उसका जो ये जो है डक्टस आर्टेरियोसस ये क्लोज होना चाहिए. मैच्योर जब बच्चा होता है तो प्री मैच्योर क्लोजर नहीं होना चाहिए, मैच्योर होकर क्लोज होना चाहिए. ठीक है, तो वो सांस लेगा. ठीक है, ये क्लोज होने के बाद वो सांस लेगा. जब पेट में बच्चा होता है तो इससे डक्टस आर्टेरियोसस इससे सांस लेता है वो माँ के ये से. ठीक है, तो जब जन्म होता है तो वो क्लोज हो जाता है. सो प्री मैच्योर क्लोजर होता है एस्पिरिन से. दैट्स व्हाई इट इज नॉट यूज्ड इन द प्रेग्नेंट. The next one is salicylism. Salicylism means it is an intoxication. It is intoxication of salicylates. So mild salicylate intoxication because of high dose of salicylates. Okay. So it develops with the level exceeding 25 mg% in the plasma. अगर 25 mg% प्लाज्मा में salicylate है तो उसमें salicylism का toxic symptom आपको आ जाएगा. So it is characterized by headache, डिजीनेस, वर्टिगो. टिंटस, वर्टिगो मीन्स चक्कर आना. ठीक है, डिजीनेस मीन्स आपको, डिजीनेस मीन्स क्या बोलते हैं उसको, अस्वस्थ होना. टिंटस मीन्स आपके ईयर्स में आपको सर्दी होने के बाद कैसा होता है, आपके कान में थोड़ा सा आवाज आता है, वो टिंटस. डिफिकल्टी इन हियरिंग, डिमिनिशन ऑफ विजन. Sorry. So it is a salicylism. Then again patient will be drowsy, lethargy and mental confusion, nausea, vomiting, diarrhea. So this is a salicylism. So salicylism occurs with the salicylic acids derivative. Then acute salicylate intoxication. So again it is characterized by acid base imbalance, electrolyte disturbances, hyperglycemia, then dehydration, hyperpyrexia, increased body temperature, gastric irritation and occasionally hemorrhage. So it is अगर acute ज़्यादा डोज हो गया सैलिसिलेट का, ये सिम्टम आ जाएंगे आपको. तो इन दैट केस व्हाट यू हैव टू परफॉर्म ए गैस्ट्रिक लीवेज. आपके उसका पेट को साफ करना है, जो अंदर पेट के अंदर जो सैलिसिलेट है वो निकाल देना है. गैस्ट्रिक लीवेज, देन करेक्शन ऑफ हाइपरथर्मिया, आपको जो इंक्रीज बॉडी टेम्परेचर है उसको करेक्ट करना है, डिहाइड्रेशन करेक्ट करना है बाय गिविंग वेरियस आईवी फ्लूइड्स. देन जो एसिडोसिस हुआ है उसको करेक्ट करना है बाय यूजिंग अल्कलाइजर्स. ओके, अल्कलाइजेशन. देन पेरिटोनियल डायलिसिस, विटामिन के देना है आपको क्योंकि ब्लीडिंग वगैरह हो सकता है, तो विटामिन के विल बी एक्ट एज एंटीकोएगुलेंट, सॉरी इट विल एक्ट एज कोएगुलेंट. देन ब्लड ट्रांसफ्यूजन्स. सो दीज आर द प्रिंसिपल मेजरमेंट ऑफ acute salicylate intoxication. Now next one is I am going very slowly. Actually इतना सारा important है, ये लेते नहीं कोई इतना. What are the application? There are numerous therapeutic applications of salicylate. So they are locally applied, act as a keratolytic, fungistatic and mild antiseptic, counter irritant. They will act as analgesic, antipyretic in case of arthralgia, myalgia, neuralgia, toothache. ये arthralgia क्या होता है? Arthralgia means inflammation of bone. Myalgia means inflammation of your muscles. Neuralgia means inflammation of your nerves. Okay. Toothache, headache, backache तो आपको मालूम होगा. Dysmenorrhea. Okay, dysmenorrhea in the woman. Then anti-inflammatory action. It is used as anti-inflammatory in case of arthritis and fibromyositis. It is having also anti-rheumatic action. That's why they are used in the pain and inflammation of rheumatic fever, joint pain. Then it also has an antiplatelet action, so that's why it is used to prevent the formation of thrombus in patient with ischemic heart disease. Again, they are used in the treatment of Bartter syndrome. ये Bartter syndrome क्या होता है? It is a syndrome where there is an abnormal increase in the prostaglandin level in the blood. So that is a Bartter syndrome. Okay. Then also it is used in the niacin induced flushing. Niacin जो है विटामिन जो है आपका B5, ठीक है, तो उससे क्या होता है फ्लशिंग, मतलब हॉट फ्लशेस, आपको गरम गरम लगता है, ठीक है, तो उसमें भी यूज करते हैं ये सैलिसिलेट. सो इट वाज अबाउट द सैलिसिलेट.